Mexico in Mexico City, and we're going to get started on our daily press conference on the pandemic, COVID, the disease caused by SARS-CoV-2. Today, we're going to focus on the technical report. I'm just going to describe one slide, and then we will go to Q&A. Dr. Alomia, would you be so kind as present the report for us? Yes, of course, Deputy Secretary. Very good evening to all of you. Let's get started with our nightly conference. This is number 87. We are on day 64 of our National Safe Distancing Campaign. Let's take a look at the update for the world context. Looks like 1 percentage point of decrease from 25 to 24, but we can see that this percentage has been fairly stable over the last couple of days. What we can see is that there's been an important, significant decrease in the number of cases in Europe. In that region, transmission rates are going down. We have over 50% of the world confirmed cases in the last 14 days in the Americas, which represents the active pandemic. Let's take a look at our next slide. 225,650 people who have been tested for COVID. They had a lab sample taken from them. In some of those cases, these people are still waiting for their test results, but in other cases, we have the results. 125,036 were negative, and 14,020 were confirmed and active, and those are the active confirmed cases since the beginning of the COVID-19 pandemic in Mexico. Now, 20% of those, the 14,020 people who have tested positive for the virus, those are people who are representing the active epidemic in Mexico. Unfortunately, 7,633 people have passed away up to date. What this shows here is the cumulative number of cases over the whole country. 55.6 is our incidence rate per 100,000 inhabitants. And on the map, we still are working with the same distribution where we see that over 80% of the cumulative cases are in more than 80% are rather, more than 80% of our states have a high number of cumulative cases. And they're in the maximum range, which is over 3,000. You can see that 4 states have over 3,000 confirmed cases. This bar graph describes in descending order the same information, starting with Mexico City, the state of Mexico, and Baja California with the highest number of cumulative confirmed cases. Over the last 2 to 3 weeks, these very same states have shown that they have the highest transmission rates. This map shows us the active pandemic for the cases over the last 14 days that have been confirmed. Here, 80% of states have fewer than 500 cases on this map, also representing onset of symptoms for these confirmed cases in the last 14 days. Over the last few weeks, we have seen this changing a little as some states are moving out of their highest transmission rates. And we see other states that are represented in darker colors as still going close to hitting the peak of their pandemic. We are predicting that around June, we'll have 10 or 12 states being at that peak point in the epidemic. This is the same information represented as a bar graph in descending order from the highest number of cases. So Mexico City has the most cases. for these confirmed active cases with symptoms being exhibited in the last 14 days. This is the cumulative incidence rate. We have 10.9% for the active epidemic in Mexico. And we can see the distribution here represented by light to dark color. The darkest green represents over 20%, over 20% incidence rate per 100,000 inhabitants. And then we can see how in Quintana Roo, it's gotten darker because it's going up towards its epicurve. On the next slide, we can also see these states represented, starting with Mexico City, State of Mexico, Sinaloa, and Yucatan, which are the states with the highest number of cumulative incidence rates per 100,000 inhabitants. The range of these cases is from May 12th to 25th, and this is where we're seeing how high the activity is. This is the slide that shows you death by date. These are the deaths that have occurred, and the date is along the bottom. Yellow, these 400, the part of the bar graph represented in yellow are the suspected deaths that are not yet confirmed to be COVID. These are cases where we're waiting for them to be confirmed to know whether these people did die from COVID or not. This is the same information distributed by state. You can see that these are the cumulative deaths since this pandemic started in Mexico, and those are the 7,633 cases. And we can see how these are distributed here over state, whichever state they died in. The yellow is that they're the possible suspected cases, and the blue are the cases that are confirmed. So those suspected death numbers could still increase. Here we're taking a look at the epicurve. You can see that the trend continues to rise. We can see the number of cases that have been confirmed daily. These are the maroon bar graph colors, the bar graph that is in maroon. And then the yellow are the suspected cases. You can also see that they are registered by when people started to exhibit symptoms. This is the cumulative burden of disease. 71,105 cases, and the new confirmed cases number 2,485, which is an increase from yesterday of 3.6%. The yellow bar graphs on the bottom are where we've been registering information every Monday so that we see after the weekend, maybe something that has happened on Saturday, Sunday, or whatever's been going over the weekend, then we take that information and put it into our bar graphs so that we have it in real time in terms of who's been confirmed as a confirmed COVID case. Here is occupancy rates and availability. This information is also updated every day. 93% are the hospitals represented in our notifying reporting hospital network. We have 701 hospitals in that network, and 93% of those hospitals report on statistics to us. We have 39% of beds occupied in the for people who have severe acute respiratory infections. And we can see what has changed from last week between patients who go to the hospital and how many beds there are that can be retrofitted or reconverted for these patients. But we see here that this has maintained stability. If we take a look at our next slide, we can see this information represented by state. There are states that have higher occupancy rates. For example, Mexico City, the state of Mexico, Baja California, Hidalgo, Veracruz, Puebla, Sinaloa, and Tabasco. And these are states that have an occupancy rate of 40% or higher. And we see that there are other states that have a much lower occupancy rate. So there isn't as much the transmission rates aren't as high in those states. Next, we'll take a look at specifically what availability is for beds with ventilators. And these are used for patients that are in critical condition. We have Mexico City, Baja California, State of Mexico, Guerrero, Chiapas, Veracruz, and Sinaloa at 40%. So they have their occupancy rate at 40% or higher, but they still have stability in terms of availability for these types of beds. That is to say, beds with ventilators. Even though we have high occupancy rates at those states on the left, there still is quite a healthy percentage of beds that are available for those people. Today is Monday, and we're going to update the information that we do each Monday, and that has to do with distribution, comorbidity, and positivity rates. On our next slide, we will show you the difference between men and women. We can see that by age and by sex, how it's affecting different people. There's always a bit of an increase or a sort of a predisposition for men, and that has been maintained at 57%. And that basically has been at the same percentage for the whole epidemic in Mexico. We can also see that people who get sicker are people over 60 and also people who are in their most productive stage, because during the national safe distancing campaign or how this has happened over weeks, these people work in essential services. So that's why they have been active, and that's why that group has been affected in this way. Our next graph will show us distribution, but by death. And this speaks to us to how the bars are moving over toward the right. So this means that people who have died are in older age groups. And as we have communicated to you and really tried to speak to you guys about, the age of someone, the older they are, means that they have a higher risk of getting complications and dying from COVID-19. Here we can really tell how that inclination of the bar graphs by sex show us that men are hit harder by this. 68% of men are represented in those deaths. So men are more affected. And we have taken a look at other international statistics. This isn't just about Mexico. We've seen that more men have died because of this disease. This information has to do with comorbidities associated with death. Hypertension continues to be in the #1 spot, 42.8%, then diabetes with 37.6, obesity 26.7. These are the three comorbidities that have been most closely linked to people who have died. But other comorbidities come into play here as well, like smoking, chronic insufficient renal disease, cardiovascular disease, immunosuppressive diseases. And these have people who have these comorbidities have a higher risk of dying from COVID. So we can see how, unfortunately, on this bar graph, these comorbidities have led or been part of people's death. Here we can see mortality, and we see how it's distributed to how people were attended to. So depending on how serious the person's symptoms were, we see that their mortality percentage possibility increases. There's a group of people who died who represented 1.8%, and these are people who were attended to at the hospital. And then we have people who were intubated, and their mortality rate was 66%. So we see the total there is 10.7% mortality rate. Here we see the positivity index by epidemiological week. We can also see it distributed by clinical state, by clinical symptoms. We can see that general positivity is 36%, but depending on clinical information, we see that percentage change. It goes down with walk-in patients. Some of the decreases that we saw last week, we can see that some of them are bouncing back now, are getting to 70% there. We're still waiting for more results from week 20. So if we look right at week 19, which is the most complete information we have for that week, we can see the degree of seriousness of the person who was seeking medical attention, and we see there that it is increasing in terms of positivity. So this speaks to the sampling and surveillance that has gone on with these people. But it also tells us that people who have serious illnesses, it's a response from their immune system. So they can't support the duplication of the virus. Therefore, the virus stays active and blocks their airways. So this means that what happens here is we take a sample and try to find whether there is COVID present in these people. So people who are exhibiting light signs of COVID means that their immune system is responding, but the viral load is lower. So the results might be lesser. That's how to explain some of the differences that we see here. So that's what we have for today. Thank you very much, Dr. Alumia. Today, I would like to briefly make some comments to you with this, imagine, with this graph. It's something that we've talked about numerous times, and this has really drummed up interest in quite a few people. But some people are confused about the terminology that we're using. For example, when we use this expression to flatten the curve, to flatten the epidemiological curve. Today, I'd like to show you a different representation of this same phenomenon, and this is the occurrence rate for cases of COVID over time. I'm going to show you the cumulative curve, the cumulative epicurve cases. These cumulative cases, I'm showing you this curve, how we add cases, the number of people who are sick each day and who report that they are infected. For this graphic in particular, these are confirmed cases, the cases that are confirmed day by day. It's important to be able to visualize this and tell you that epidemiological monitoring doesn't depend just on confirmed cases. It depends on many different indicators. For example, when we talk about people who are ill and they're suspected to have COVID. So people who are suspected to have COVID, they're exhibiting symptoms, and so people sample them and they are a suspected case. We think they have a serious enough disease to be hospitalized. So then we send their tests to the lab. And a little bit after, 6 hours later, after the whole process has gone through, has taken its course, they've taken a test, laboratory communication, let us know about the results. That takes a few days. That's the context. So here I'd like to tell you that we're talking about cumulative cases. And these cumulative cases always increase. They never decrease. They increase until they get to a point where they are not increasing anymore. And the only thing that can happen is they become a horizontal flat line because time has passed, and there are no more cases being presented. This happens when we're at the end of the epic curve with regard to new cases, that famous curve that looks like a mountain. When you go up the mountain, that's going to be the highest transmission rate. And when it's going down, the number of cases are decreasing, the number of new cases. That is when we are flattening the curve, when we're not adding any more cases to that curve. That's when the line gets flat. I'll tell you exactly when we see them, just so that you can exactly know what I'm talking about. We'll come right back to this one. Let's go back a couple, and then we'll come back to this graphic. Back, 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 there, next, there. This curve. This is the curve that you're all very familiar with. We show it to you each night. This is the cumulative confirmed cases, the number of cumulative confirmed cases since February 28th, when we had our first registered case. So this epi curve is never going to decrease. This curve only represents the cumulative number of cases that are in our country. The active epidemic are the last 14 days worth on this curve, right about to right here. This is the active epidemic. This back here, this is what has already happened. This is what is in the past. For these people who very unfortunately lost their lives, and or the other people who recovered and have gone back to their daily lives. Now let's go back to the one we were talking about. Here. What this graph depicts are mathematical predictions created by a scientific group that we've been working with. These people are from the Mathematical Research Institute. It's a public institute, part of the Science and Technology Institute, and the mathematics department at the Universidad Nacional Autónoma de México, the UNAM. And we are so grateful to these people and institutions for their help. And of course, the National Science and Technology Council, thank you so much. Dr. Maria Elena Vares Guya, thank you for your coordination. With this epi curve for new cases, which you're also familiar with, we also have another part. These two axes are the same as the other graphs. Time on the bottom, days that have gone by. These are the dates. February 27th over here on the left. That's when we registered. The first case was registered, which was confirmed the morning of the 28th. And these are the number of cases that are registered over that period of time. 5,000, 10,000, 15,000, all the cases that we could possibly register over time. This red line, this represents what would have happened if we hadn't taken our actions with our safe distancing campaign. Where does this idea come from? Where does this projection come from? It comes from the information that we have observed up to March 22nd, which is the date when we started to implement our national safe distancing campaign, married with a mathematical model that speaks to the probability of how susceptible being exposed to the virus is, how possible, what the risk is to recover, what the risk is to get sick. This is a classic mathematical model. It's called the Seir model. But what I'm getting at here is this is what would have happened if we hadn't taken our safe distancing actions. What would have happened? We would have started. You can't see here because the curves are right on top of each other, but there is a red line here as well. We would have had the cases. They would have increased day by day. We would have had these are the new cases, and it would have increased and increased and increased. until it got to a point where it couldn't go up anymore because the epi curve was at its highest point. And at that moment, which would have been April 10th, we would have had the epidemic pushed right out. And I'm talking about Mexico City here in the Valley of Mexico. So we would have reached the crescendo height there on April 10th. And then after that, we wouldn't be getting any more cases. And then we'd have that horizontal line right there. And that would represent the number of cases that have been accumulated up to today. And what you are seeing, which frankly is impressive, just from March 28th to April 10th, in those 12 days, we would have totally run through the whole epidemic. We would have had a very short epidemic. We would all be a lot less worried right now if that had been true. But no, because what is worrisome here is that we would have had so many cases. We would have had all the cases that we could have had over a number of weeks and months. We would have had all those cases compounded into 12 days. And that means we would have almost 40,000 or 38,000 cases in just 12 days. That would have collapsed our health system. We wouldn't have been able to receive so many people. And we're just talking about Mexico City here. Now, what we don't have instead of that, because that's what would have happened, here we have three other curves. And see here in the dark blue color, navy blue, that's the original projection for March 22nd. That's what would have happened. But what happened is we stepped in with those safe distancing actions. The other two are clear. The green one is an update for the April 27th. And the most recent one for May 21st. We've had a couple others each week, but those are the three so that we don't crowd the image there. The curves are very similar. These columns, the bar graphs here that you see in magenta color, these are cases that are confirmed over time. You can see clearly how the projections that were made, that they have been very true, very close to reality. This has been very close to the reality of what has happened over the last few weeks. We've had 21,800 cases that we have observed. Make sure, note bien here, please take a close look that this is just until April 13th, okay, 21,800 cases. And we estimate that what we would have had at that date would have been 38,773 cases. So the projection, 23,398. And what we actually had, the projection was 23,000. What we actually had was 21,000. But what's going to happen? Some people have been very confused about this. They've said, where is it flattening if this curve just keeps going up, up, up? This curve is going to continue going up until it reaches the inflection point where it does not keep going up anymore. And that's when we do what we call bending the curve. That's the inflection point. That's when we change the curve's direction. When will that happen? That will happen when we're on our way down to that final descent. I have to tell you, we're still at the half of this epi curve. That's going to happen up over here. When? We have pointed out some dates on that other curve. At the end of the day, we're going to have the same, are we going to have the same number of cumulative cases? It could happen. We don't know. But the idea is that we're not reducing the N number of cases. The primal objective here is for cases and contagion. We want them to happen in a longer period of time so that it doesn't happen quickly and collapse our health system. We want to be able to give medical attention to people and not have to turn them away. So this is another visual for you to see how the curve has been flattened. The epi curve was flattened. This is the curve of what has been happening, and this is compared to what would have happened if we hadn't taken our actions of safe distancing. Let's open up the Q&A.
Let's start with you, Bianca, then Liz, and then with the rest. Thanks so much. Thank you, Dr. Saturnino Reyes from Dario, Doctor. I have three questions, quite straightforward, really. The first one is, what is going to be the celebration in Mexico on Saturday? Because seems like some TV chain is announcing that there's going to be some celebration, which may cause some confusion within the people. We are right now having the stoplight measures, and so I'd like you to answer first, what is going to be the celebration first? Number two, what to do so that the people, the population continues to trust the health institutions. My question is because of this. There have been some cases in some states like Veracruz and Mexico, and here in Mexico City as well, where some people have symptoms and they'll rather not go to the clinic because they're saying, if I go there, I won't live alive. So, and why is this? Because one particular case in Veracruz, a person came into the hospital because for a knee surgery. What happened inside, we don't know, but half an hour later, this person died. And the funeral services, when they talked to the family of this person, they asked them, they told them to write in the death certificate that this person had died from COVID when it was actually from a different problem. So I'd like you to please make this clear for the people. And the third question is, what is the lesson that you might have got in terms of epidemiology, this pandemic in particular, because this disease, I don't know how it's going to be labeled. Some disease or health conditions within the health systems, patients are not treated for this because it's expensive for the state. So how expensive is going to be for this state to treat patients in the future? Let's say that we are in green color in the spotlight, everything's going well. So how is this disease going to be labeled amongst other diseases and health conditions so that it will be treated accordingly, and so that the Mexicans have actually this access to health care? Because some people don't have benefits under the Seguro Social. They might be within Savi, depending on this healthcare they have. That will be the treatment, and sometimes they'll have to pay for something. So if you can please answer this for us. Thank you for your questions. This allows me to gives me a chance to remind the population of some things. In terms of the fear, this is something that we know mostly by some stories that we hear, such as the stories that you just told us from Veracruz. This is something that, of course, can occur in different parts in the country in which symptoms with people with symptoms, COVID symptoms. Let's remind that those symptoms are fever, sore throat. We can also start with body aches, fatigue, redness in the eyes, runny nose. Rarely some diarrheas and maybe some other symptoms such as a lack of taste, lack of smell. But as we've mentioned, and again, thank you for the chance to remind this, this is a disease that can change quickly from being a mild disease to becoming a, a serious and critical condition that may cause the death, COVID. So people at risk for this or higher risk are those elderly people, people with some critical, some health conditions, those conditions that were showed, such as hypertension, diabetes, obesity, obesity in particular, smokers as well. That is a health condition in itself. So using tobacco products may cause some problems on health conditions. This is something that we've known for a long time already. The immunosuppression when in this because of cancer treatment, some chronic infection problems, HIV as well, AIDS, etc. So in these people, amongst these people, it can start as a mild disease, and people might consider it necessary to go to seek medical attention, but in a few hours can evolve and can progress and become a critical condition that may cause respiratory failure, problems with the lungs, and this can turn in a very complicated situation. As an additional action for precaution, this is something, we have a really high rate of chronic conditions in Mexico. These medical conditions that I just mentioned, people with family history of diabetes or hypertension, it's advisable that they have to take additional precautions, and they have to assume that they might as well be among this high risk population, because a lot of these people have these conditions like diabetes and hypertension. They don't even know that they have this condition. They don't know until the COVID, in this case, uh, tells them that they have this condition. So for those people with family history of hypertension, diabetes, and we talk about first degree family relative, we have risk for complications. So going back to the fear, fear is a natural reaction in human beings, also even in some other species. This is a defense mechanism. This is something that we cannot just program and make it exist or just not exist. This has to do with what information we have, how we try to manifest this feeling and receive a positive response from those receiving that. We can address this and this fear and use it as a useful warning sign that might protect us. So my recommendation for the families is, and even for friends, for those who show COVID symptoms, let's help them to go over that fear and some elements of information that may help us to address in a positive way the fear as a protection tool. It's to have in mind clear that the disease will not become more serious when we go to the hospital. It's actually when we don't take actions, even if we are having some signs of complication, in particular the difficulty breathing, the fatigue, um, palpitations, heavy breathing. This means that we've let time pass. So when that person reaches the hospital, the complications might be so advanced that unfortunately that person might not be able to recover. But it's not that the hospitals are doing anything wrong to the people or the assessment is doing something wrong to them. It's just that the disease has been progressing for a long time already. This is not new only for COVID. This can happen also with some conditions like diabetes. Like, for example, some people know that they are diabetics, but precisely because of this problem of people just waiting, they just wait and wait until the damage is just too much in terms of maybe renal kidney failure, some um, lesions in their feet, which means that they don't have their feet are affected by diabetes. So the the lesson here is that COVID can become serious, can affect all people, especially people with problems with diabetes, obesity, smoking. The risk for complication in these people are higher. So if a person has a family relative with diabetes, hypertension, they shouldn't wait to seek medical attention. The celebration on May 30th, my point of view is that we are not celebrating anything because we have to know and be aware that we continue having an active pandemic. We are concluding the National Safe Distance campaign, but all those states where you live, it might be that the stoplight is in red or in orange or in yellow, and that means that there will be restrictions. If you don't work in an essential activity, you won't be able to work if the stoplight isn't red. If you live in a state in which the stoplight is in an orange color, you won't be able to go out to the public space for leisure activities. So there's no celebration here that we're having. It's just being aware that we have achieved something good in this pandemic. We were able to reduce by 75% the intensity of the infection, spread of infection, but we are still a long way to go. And this depends on on everybody in society. So how are you going to label the COVID and what's the lesson that you take from this epidemic? In terms of lessons and learning, we will have to talk about this in probably one or two lessons about the different. This is something that I'd like to address in general about all lessons that we have got so far, and we'll have a chance to do it. Now, COVID will be considered as one amongst hundreds of acute respiratory infections that may cause mostly a mild disease. And in some cases, they become critical in some people. 5% in terms of COVID for those who require ICU services. And in Mexico, since January 1st of 2020, we've been taking this quite seriously because this is in the Constitution and the fourth article number 4 since 1984. And that means that the healthcare is a right for all people in the national territory. And the process for transformation for the national health system is still in its way. We are focusing it right now on COVID, but we'll be readdressing it once this is over. Good evening. Well, first of all, we want to congratulate you for the invitation by the OMS to join this group of experts. And well, after this, please, my question is, what about this? What you said about the face masks. This is going to be an auxiliary measure in terms of the transition to the new normal. And also, well, I'd like to say you probably heard of this that some healthcare staff and the national outside of the in-air, they are stating that the N95 mask, they want them to reuse them. We heard that a truck arrived with some equipment, with some screens and cell phones and some masks, and which are on a fixed active, but they are not being released for their use. So we'd like to know what is going to happen with that. And well, in terms of the pandemic, they're still expressing that they don't have the supplies, the medical supplies that they need. So with this last question, I'd like to start. This morning, we heard that some healthcare staff, I understand that most of them work for the INER, they expressed these concerns, and this is something that we like, the fact that people express their concerns. And it's great that we have the freedom for these manifestations to happen. So it seems like some of the problems here have to do with some misinformation. It's information that's not really certain. With regards to the cell phones, we haven't really bought any cell phones because it's not really a relevant tool right now for the control of the epidemic. Some other things might be, depends on what they're talking about. Maybe the chief on finances on the health care ministry, they probably uh, heard this, and on behalf of everyone, all of those working on the ministry, including the Dr. Alcocer, they made note of this. They are addressing these concerns, and they will continue to work on this. I understand that tomorrow they have a meeting to address this and some other things that might be product resulting as from some misinformation is that there's some technology to reuse the N95 masks. There's a system or a mechanism to do it, but so far we have decided not to do this because we don't really even have a problem with the supply in regards to the masks. The use of masks today, I was participating in a meeting in regards to the control of the COVID epidemic, and this was along with the people from the IMSS, and we keep working on some of the guidelines for safety in the place of jobs, and I'd like to talk about this today. This is something that apparently has made a lot of people nervous, probably those same people who have been concerned about the flattening of the epi curve. So for some reason, some people have some concerns, and of course, I want to show my respects to these people. And with regards to this, with the mask, so at some point, people interpreted that I was like an enemy of the masks. I think it's clear that this is not the case. It, it is not to say that there's something official stating that we are against masks. So masks is something, is a mask mostly out of some, this is something that can filter some elements, and we usually use it in surgery situations to protect the person, and this is to keep the respiratory secretions from the health staff to go into an area that's supposed to be sterile. So it's been very clear that the masks are an important, a good instrument to keep some of the elements, some germs that may come from the airways from of the person who's wearing. So it helps if the person who has symptoms from COVID or it's been confirmed with COVID wear it, because that means that this person who's wearing the mask, there will be a chance to spread the germs. So the, what I can say is that the mask doesn't protect the person who's wearing it when from getting infected. So the generalized use of masks to So those persons who are in a pre-symptomatic status, those persons who are infected but are not showing symptoms, there is a low risk of infection. So with the hope to, in the massive picture, decrease that probability, some people in some parts of the world recommended the use of masks. There's no scientific evidence so far up to this point today, May 25th, that mechanism is useful in the general way. Why? Because wearing a mask requires a discipline, it requires to be constant, and also requires the people who might be presymptomatic or asymptomatic to wear it all the time. They can't touch their faces um, when they throw it away. They have to throw it away in a safe area so that no one else will grab it. Uh, Avoid rubbing eyes, etc. So, what's the balance? What's the balance in terms of the massive use of it? Knowing that a lot of people cannot will probably not wear it appropriately, and that means that more people might be infected around them. This is an unknown information in general. And so that's why some health agencies, such as the Centers for Control of Disease in the United States, they recommended it. The WHO recommended it, and some agencies in Europe stated that there's no formal recommendation for this. So this is how we set it here in Mexico. It might be an auxiliary element, but why now am I saying let's wear it? And now I even have mine here. Why is this? Well, this is because this is something easy. During the national campaign, which we still have, the emphasis was to stay at home. That was the main goal. If we now readdress the attention to some auxiliary element with a dubious effectiveness, this is something that we have explained so far that in Mexico, because of some social characteristic and economic characteristics in Mexico, we have learned that the person will not, the object of intervention will not be the person. This is something particular in Mexico. The person is not the protagonist of Mexico, but the structure in terms of public spaces, schools, and jobs. So what we do is to reduce mobilization in public space, and we do that to the structures, to the owners of companies, those who are in control of schools, and we did it that way because of the reasons that we explained so far. So introducing masks so far might have resulted in some confusion, as it happened in some municipalities where they started trying to force people by finding people or trying to arrest people, as it occurred in some states, which we are against of. So to finish this, now that we're coming to an end in the campaign for the safe distance, even though we will continue we will continue to have some restrictions in different states, this will be now an alternative element to use in some closed spaces, such as transportation, in which we will have more mobility. So, be in a bus or in the subway, so close to people that people won't be able to keep the safe distance, might be a good idea to wear a mask. But I insist, just to avoid spreading of the virus and those people who are sick, not to protect people who don't have the infection. I think we might have some time for one or two more questions. Thank you. Lisbeth Alvarez from Dario Basta, Grupo Cantón. Dr. Well, with regards to the INER, on May 10th, I actually read the letter that the employees received with regards to the PPE that they didn't have. So why not paying attention to this? And now that they are having this protest, why putting attention to this when we have already mentioned this problem right here in this forum? And next question, with regards to the masks, what about the hypoxia? So people are now leaving their homes. Protection action is wearing a mask. People in the public space are saying that they sometimes they feel some difficulty, shortness of breath when they are wearing this mask, their masks. They are complaining of dizziness, even with this using the mask. So is this what we call hypoxia, or is this something different? With regards to the air, we always have to pay attention and listen to people, and we do it all the time. To those who are expressing some concern or some problems, and especially when it is a matter that the government has to address. So with regards to the people who express their concern, it doesn't mean that they necessarily that they work at the INER. It's not all of them. It's just a group of people who we definitely our respects to them, and we really think that their concern is legitimate. So, but what I want to say is that this is not the same phenomenon. Might be some other people expressing some new concern. It might be some people expressing a different concern in different time. With regards to the masks, going back to that, it's difficult that a mask such as this, including even the N95, they have a characteristic which keeps a little bit the flow, the air from flowing, and that makes it a little bit difficult to breathe. I mean, nobody has died of suffocation because of wearing a mask. But something that can happen is two things, and I might want to point. One is an increase in change. This might change the alkalinity levels in the blood, and this is something that you might not know, but this is something that we use frequently at in the OR when someone's having a problem of anxiety, acute anxiety, and they start breathing fast. That means that there will be less um, carbon dioxide in the blood. So now we have an acidity level in the blood. It's not a critical acidity level, but it's mild, and that will cause some cramping in the hands or something. And the action to do here is to use a bag, a paper bag, to breathe into that bag, and this will help to change this status of the person or this condition. The opposite that may happen is that we can start having more carbon dioxide in the blood, and this can result in some sleepiness, some dizziness, a headache. Um, some person might describe it as that they feel that their head is expanding, and this may result in the person fainting. So this can happen, and the person might feel very anxious when this happens because they have some type of obstruction in their airways and also in the area. But I would say there's no danger, no high risk in using this, and no one dies for wearing a mask. Up to now, so far, May 25th, I've got no symptoms from related to COVID, and I'm wearing because of the two reasons. And this is why we will be now showing this the use of masks as an element of help in this scenario after the national campaign for the safe distance. And this is on also, of course, out of respect of the institutions and the guidelines that the IMSS and other institutions have been So how do you wear? How do you put it on? You want to see how you put it on? Well, some of them, this has this sort of a metallic wire here that can mold and fit around the nose. You can fit this one on your ears. You put it on, you fit it on the ears, and you keep it like this. It is important to say that there's some air that can come in here. So if I had COVID, there might be a chance that some of the air might come out along with some germs. So this is not a 100% protection. These are good for use for an entire working shift. You have to throw this away in a special area for biohazard trash. Of course, I won't. I throw it away. I have no symptoms, so I am assuming that there's no transmission. There's no risk for transmission, but I will make sure that my family don't get their hands on this. Now it's 17:01. This is the end of our press conference for today. Something very important to say, tomorrow we'll have a meeting with the governors, and we'd like to talk about this first. Once we come to a conclusion with them, we'll present it to the public. Thank you so much. This will be tomorrow at 10 a.m.